Okay, let's start with a tough question. If we could remove more of a patient's tumor during surgery, like absolutely cleanly, could we actually extend their life expectancy, reduce the risk of it coming back?
It seems obvious, right? A total no-brainer.
Yeah, but the reality in the operating room is, well, it's incredibly complex. Knowing exactly where the tumor stops and healthy tissue begins, that's one of the biggest hurdles in surgery.
A really formidable challenge.
Exactly. So today we're doing a deep dive into a company called Beams. They're a French med tech company, and they've developed something called TRIOP technology
And their whole mission really is to tackle that exact problem. They want to bring cutting-edge precision to oncological surgery.
to fundamentally improve patient outcomes.
Right. It all comes down to that core surgical dilemma,
Yeah.
the tightrope walk surgeons face every single time.
You mean needing to get every last cancer cell out?
While desperately trying not to damage vital healthy tissues right next door, the stakes are just unbelievably high.
And this isn't theoretical. I understand the whole idea for Beams came from a very real clinical situation.
It did. Think about this. A 44-year-old patient, brain tumor, and it's located dangerously close to areas controlling, say, speech or movement.
Oh, wow.
So the surgeon is faced with this agonizing decision right there on the table. How much can I take? If I go a millimeter further, do I remove more tumor or do I potentially cause permanent harm?
That precise dilemma actually inspired one of the co-founders.
Yes, Professor Stefan Palfy, he's a neurosurgeon, saw cases like this firsthand. It weighed on him. He knew surgeons needed something better, something more precise, more immediate.
So Beam's mission grew directly out of that need, to give surgeons the tools for, well, truly complete removal while keeping the patient whole.
Exactly, empowering them.
Okay, so let's talk about the solution, this TRIOP technology. What is it, fundamentally? How does it work?
So TRIOP is essentially a combination device. It merges a tiny beta particle detector with a surgical aspirator.
Beta particles. Okay. How does that help find cancer?
Well, before the surgery, the patient receives what are called beta radiotracers. These are special molecules, commercially available, designed to accumulate specifically in cancer cells. They basically make the tumor cells hot with beta radiation, but not the healthy cells.
Ah, so they tag the enemy, so to speak.
Precisely.
Yeah.
Then, during the operation, the TRIOP probe, which is miniaturized, detects these beta particles in situ, right there in the surgical field in real time.
And the aspirator part.
That allows the surgeon to immediately remove the tissue that the detector identifies as cancerous. It's detection and removal integrated.
So going back to that patient with the brain tumor, the surgeon isn't just relying on sight and feel anymore.
No, they're getting this active real-time feedback. The detector can warn them within seconds if they're near or touching cancerous tissue. It allows for this incredibly fine distinction between healthy and diseased areas.
Millimetric precision, I think they called it. That must be huge.
It's potentially transformative. That single millimeter could be the difference between leaving a cluster of cancer cells behind or maybe damaging a critical nerve.
And is this just for brain tumors or is it broader?
That's a key point. It's designed to be versatile. The idea is it can work with any type of cancer where these beta radiotracers can effectively target the tumor cells.
So potentially a wide range of applications in oncology.
That's the goal. It's positioned as a platform technology.
Okay, so Beams itself, founded in 2021, came out of the CNRS in France. Their vision seems pretty ambitious.
It is. They want to redefine the standard of care in cancer surgery, better precision, better outcomes, and they also talk about contributing to a more sustainable health system, perhaps by reducing repeat surgeries or complications.
And how are they developing this complex tech? I heard they're using some advanced tools.
They are. They're leveraging Dassault Systems' 3D Experience platform, which is it's more than just CAD software. It's a whole collaborative environment for design, simulation, managing data, even helping with regulatory compliance.
So it speeds things up, makes development more efficient.
Exactly. It helps streamline the whole process, especially for something as complex as a medical device. And the CEO, Virginie Simon, apparently has significant experience with these kinds of platforms, which is a big plus.
Right, having that expertise in-house, and they have a target for getting this to market.
They're aiming for 2028. So still some ways to go, but a clear target.
So let's bring it back to the impact. For someone listening, maybe someone who's faced a cancer diagnosis or knows someone who has, what does this ultimately mean?
Well, the promise here is significant. It's about giving surgeons the confidence to remove as much tumor as possible, even microscopic bits, while being much more certain about protecting healthy, functional tissue.
Which translates directly to better chances.
Potentially, yes. Extending life expectancy, reducing the risk of the cancer returning. That's the ultimate goal. More effective surgery, potentially less invasive overall impact.
It really paints a picture of a future where that fear surrounding surgery, the fear of what might be left behind or what might be accidentally damaged, could be significantly lessened.
Mhm. Tools like this aren't just about improving medical techniques. They fundamentally shift what's possible for patients. Better recovery, better quality of life after cancer.
It's moving towards surgery that's not just hopeful, but increasingly precise and maybe even certain, a really powerful direction.